Well, in health news this morning, Helen DeVos Children's Hospital has expanded even more. They've now opened a new clinic to help those who are facing conditions such as hay fever and immune disorders.
All right, and joining us this morning is Dr. Nicholas Hartog. Thanks for being Dr. Hartog. How are you?
I'm good. Thanks for having me this morning.
Can you help? We should probably switch seats so you can diagnose.
Yeah, well, I already hit him up before before we started because my eczema, I've been fighting it since I was 2, and I'm sure you start having a lot of parents that kind of come in with hesitations. Is it eczema? Is it this? Is it that? So what kind of conditions are you guys seeing?
Yeah, we do. Eczema is one of those, and that does show up a lot in kids at a young age. I mean, even a couple of months old, we see eczema, and it can be very difficult to control.
Yeah.
Oftentimes, eczema is going to be one of the diseases that we see to tip off that somebody's an allergic type person, that they're going to have a few more troubles down the road, and that includes allergic rhinitis, so hay fever, allergies, environmental stuff, asthma too, and then also food allergies. And a lot of researchers came out recently that eczema can increase your risk of having different food allergies, which is a big problem these days.
I'd never heard of a connection between eczema and food allergies.
Neither. And so far, I don't know that I have food allergies. I know mold and dust are two things I'm extremely allergic to. But a lot of parents, new parents, or parents that have had other kids and new kids come along, they just don't know. They think maybe they're being overprotective or that sort of thing. So they come to see you instead.
Yep, and there's a lot we can do, and especially there is a big connection between the eczema and the food allergy. And the thought is that the food's being introduced through your skin instead of through your mouth, and so there's a different way that your immune system is seeing the food, and it doesn't like the way through the skin. And in fact, there's a lot of recent stuff, and one of the things we've been striving to do is the kids who have young severe eczema is if we start introducing foods very early, even 4 to 6 months, we can potentially prevent food allergies, including peanut allergy is the one that most research has shown. And so the treatment end of food allergy, the research hasn't panned out so far, but right now preventing food allergies is a hot topic, and I think that's something we can really do something about in these kids with eczema.
And you mentioned peanut allergies. Now, growing up a while back, that wasn't as prevalent as it is today. Yes. And what was the shift and the change of how this came about?
So I think there's a lot of things, and what really triggered it, the honest answer is no one really knows, but if you look at about 1998, the food allergy epidemic just spiked. The rates just spiked, and the overall rate of food allergies then was 1–2%. Now it's 8 to 10%.
Wow.
With peanut allergies probably being 2 to 3% of that. And part of the reason that the spike happened is really in the year 2000, the American Academy of Pediatrics started recommending delayed food introduction. So let's wait 2 years to introduce peanuts. And now looking back, because of what I just talked about, we think that probably did more harm than good, and we probably caused some food allergies by saying let's wait on the foods. And so that's where the shift in the last year or two has really came to start foods early and often in order to prevent it. And so hopefully we can get this curve going back down towards the 2% range, and it doesn't keep going up. That's the goal right now.
And you guys also focus on immunodeficiency. What is that?
Yeah, so that's one of my particular interests. And so that's what I like to say to parents, and the quick explanation is if you think Bubble Boy, so that famous movie is, that's the type of patient. And there's a lot of variations between that, but he had what's called severe combined immunodeficiency, which Michigan has a newborn screen now to detect. So we usually have that detected within the first week or 2 of life, which saves kids' lives, just flat out saves their life now. But other than that, there's many other things that kids can have that ends up being that their body can't fight off infections, and so they get more pneumonias, more sinus infections, ear infections, and those kind of infections that a normal kid should. And so that's what we really try to identify those so we can do something about it.
And once you've identified that, what type of treatments go for those children?
So there's a wide variety of treatments. Some can be just a daily antibiotic. Sometimes we replace the protein that you're missing through the IV. And another one in like a severe combined immunodeficiency of the Bubble Boy, we sometimes have to go as far as a bone marrow transplant. But for that, it sounds like a lot, but it's curative, and they're great after that. And so it's a life-saving treatment for them.
Yeah, sure, it may sound like a lot, but I mean, the payoff at the end of that is absolutely worth it. It's a life-saving procedure.
So a lot of times parents, they don't know when it's time to actually go see a specialist. They've been to the regular doctor over and over, they've tried everything they've said, but at what point is it time to say, you know what, and do they have to get a referral to come see a specialist? So
they can get a referral, or they can call our clinic on their own. Either way works. The biggest thing I would say is if your primary care doctor is struggling to take care of this. There's plenty of primary care doctors who can take care of asthma, who can But then when it gets more advanced, harder asthma, come see us. Or the food allergies or eczema. If you have a kid who has severe eczema right away, or starting to pile up where they have allergies, they have eczema, and they're starting to get a lot of problems, that would be a good time to see us. Or on the immune side of things, if there's a concern that your kid's getting sick all the time, more than other kids, that absolutely is a reason to come see
And
us.
it goes beyond just the daycare sickness, pretty much,
Absolutely.
right?
Well, we're fortunate to have it right here in our community.
Yeah.
Thank you very much for the
Thank
time,
you so
Dr.
much.
Hartog.
Thank you, guys.
Appreciate
Some
it.
great insight. All right, the Pediatric Allergy and Immunology Clinic is located at 35 Michigan Street Northeast, and you can get in touch with them by giving them a call, 616-267-8150, or go online to HelenDeVosChildren's.org/allergy and immunology. Coming